Good day, viewers. My name is Paul Totti. Today, I want to talk about prostatitis. If you go to my Facebook pages, you go to our website, thecenterbars.org.ng, or you go to a whole lot of other social media platforms where I have talked about our herbal products, you'll find out that prostate enlargement and maybe infection issues have dominated the page. But today, I want to talk about something that is very, very important. Very, very important. It's important I talk about it, and that's what we call prostatitis. Prostatitis is an inflammation of the prostate organ. Infection can do a whole lot of things to the prostate. Most times, if care is not taken, most people, they just do PSA test, which is called prostate-specific antigen. They also do prostate scan, which is also meant to visualize and see to what extent, if a prostate is enlarged, to what extent it enlarged. That's the essence of a prostate ultrasound or prostate scan. Okay, so if a PSA is done and prostate scan is done, it will be able to give you a picture whether or not at the elementary stage, whether a patient is having prostate enlargement or elevation of PSA. These are the fundamental for you to be able to know what treatment you can hold. Because apart from that, those whose prostate is already enlarged, you find out that they have issues, as I've always talked in my program, where I always emphasize the fact that the prostate enlargement can lead to difficult urination, excess urination, urinary retention, inability to empty the bladder when you urinate, especially among men. Okay, of course, prostate is only for men. These are some of the symptoms. Okay, but I want to talk about something that is very important, which is titled prostatitis. Prostatitis. What is prostatitis? Prostatitis is an inflammation of the prostate organ. It is not prostate. It's not by itself an enlarged prostate, but it's an inflammation. And of course, a lot of things have been deduced by researchers as to what actually irritates and causes an inflammation in the prostate area, and that is what is called prostatitis. Infection can really be very serious and can lead to very serious challenge in handling prostate enlargement treatment, even when you are treating PSA. At most times, from our research, and even when we send patients, wherever they may be, send them for diagnosis, you find out, okay, the PSA was down today, but tomorrow it has gone up again. If they don't try to find out whether there are infections, it will really continue to be that way and give them that challenge in actually getting a proper treatment. So that's why I'm talking about prostatitis. Prostatitis can irritate the prostate. It can cause inflammation. It can cause you pains. It can cause you pains ordinarily, maybe when you don't urinate. It can cause you pains at the point when you want to urinate. It can cause you pain, even ordinarily at any other time. You can feel pains at the urinary tract region, due to the factor that there are infections occupying the prostate area. And that's why today I'm talking about a formula we call Pro-E. Pro-E is a formula, apart from the fact that it will aid in the treatment of prostate enlargement, apart from the fact that it will also help to reduce the PSA, it is very, very important that infections that occupies the prostate, which gives a whole lot of concern to the patient having prostate enlargement or whose PSA is elevated. Any patient that has been diagnosed that passing through that and having issues with the painful urination is obviously as a result of prostatitis. And of course, if proper tests are done in that direction, by way of maybe taking samples of the tract from the tract area, you can call URETRAL swab, you can call other maybe urine culture, you can call blood culture, and a whole lot of other samples that can be taken to analyze to find out if there are infections, which of course must go through culture. Prostatitis is very, very important, and no matter the treatment. So that's why you can give a proper treatment for patient. Maybe Prostatitis herbal is fine, you give him and he's doing well, then you find out that he's talking about infections of the prostate. That's the essence of my talking about Pro-E capsules today. Wherever you are, give me a call. Let's handle that aspect. Where you have that pain that is really disturbing you, that's not helping you to do anything, and it's not you are not finding it easy at all, no matter the treatment. Maybe you have taken within or outside the country. Pro-E, of course, if you go to the center bars and ask about the things we have done, you may have been in touch with us and presenting Pro-E capsules to you today. It's amazing products, and I'm sure you'll be glad. Why do I need to buy Prostatitis herbal and also buy Pro-E? Since it seems to you that it's doing the same thing. It's a good question, but let me point out something. Prostatitis herbal only deals with the prostate enlargement and addresses the issue of the PSA and prevent cancer. Yes, Pro E does that too. It helps in the urinary flow, relieve difficult urination, but Pro E plays the role of an antibiotics. Okay, it has effect in fighting infections in the prostate. So that's why Pro E is different a little bit from Prostalane Herbal, and is also very important in the use. Because somebody can be okay with the Prostalane, in terms of urination, excess has stopped, difficult urination is gone, the PSA which would have led to cancer has reduced, then the person still have infection. So Pro E is for prostatitis, okay, for the inflammation of the prostate itself. It releases the patient from the infection, which he notices most times when he urinates, and pains maybe in the urinary tract, and the inflammation of the prostate region.